Hello, my name is Ryan Alfonso, one of the senior editors here at MedCompare, and today I'd like to give you a closer look at the Selecta II glaucoma laser system by Lumenis. Cleared by the US FDA in 2001 for the treatment of patients with open-angle glaucoma, this new SLT system triggers a remodeling of the trabecular meshwork, which allows for greater aqueous outflow, thereby achieving significant decreases in intraocular pressure. Because SLT does not create thermal damage and scarring of the trabecular meshwork, secondary treatment, even years later, should also become a viable option. Studies of SLT treatment as primary therapy are currently underway. SLT has the potential of one day becoming the standard of care for open-angle glaucoma patients. To learn more about SLT technology and the Selecta II glaucoma laser system, we turn to Dr. Andrew Iwa of the Glaucoma Center of San Francisco. He's used SLT technology in his own practice since it was FDA approved in 2001.
The SLT technology can be used in two different formats. Lumenis has produced a portable SLT 2 unit which can hook up to a slit lamp. There also is a duet unit which has both the SLT as well as a Q-switched gag component which is fully integrated. Patients will ask us what type of procedures are available, what type of alternatives do we have in treating this disease, and SLT is one of the ones that we discuss. And often it at least reduces, if not delays and eliminates the need for medications for that time period. Here in the office in downtown San Francisco, every square inch of our office is precious. And this technology allows us to hook up the actual laser unit to our slit lamp. The cable then goes off to the power source, and it allows for us to use an exam lane for multiple purposes. A great piece of technology. It's portable, it's compact, we can hook it onto our slit lamp, or at the hospital we have a duet unit which has both a Q-switched YAG as well as the SLT mode. Patients like it. ALT was useful, but SLT is different. It uses a lot less energy. Patients have read up on it and like the technology, and it's comfortable. In our practice, a number of patients that are higher risk are referred in. These may be on maximally tolerated medications, and yet surgical knife surgery is not without risk. Even in some of these patients, the appropriate patients, SLT, depending on their profile, may offer an opportunity to at least delay, if not avoid, surgical interventions associated with their complications. And of course, the litmus test on any type of a procedure or test is, what would I have done to myself or a family member? And given the two options, I think SLT stands out as the clear alternative.
We also had the opportunity to speak with Tom Bruner, who's the president and CEO of the Glaucoma Research Foundation in San Francisco. He shared with us the potential financial impacts of this technology from both the perspective of the patient and the physician.
Medications can cost several $100s, depending per month, if they're multiple meds. So that SLT can be an option that sometimes would be reimbursed by insurance, and so the cost of the patient would conceivably be significantly less. One of the concerns is the importance of maintaining lower pressures to preserve vision, and there are many different ways that can be accomplished. The typical approach today is still with drugs. SLT is another pressure lowering option. And the thing about drugs, and particularly for younger people who are very active, it can be a problem just either taking the drugs or remembering to take them. And so when you have an option like SLT, where you do it once and it can last, as much as 10 years. I mean, it varies with different people as to how long the therapy lasts, and then it can be repeated. Selective laser trabeculoplasty is quite new. And it's something that does offer another option for the patient and for the doctor. And what I've been told, it's particularly useful, for example, if you have a patient who you suspect isn't going to be able to either afford his drugs or use the drugs reliably, that's a good opportunity to use something like selective laser trabeculoplasty, because SLT, the doctor does it, and so the patient's been treated, and they have their therapy, and you're going to have the pressure lowering effect that you want.